So Jeremiah is the ANHE Fellowship Program Director. Originally from a small town in Northern Virginia, Jeremiah attended American University, where he received a degree in political science. Since graduating, he consistently seeks out positions that advance equity for communities with high levels of divestment. He taught in DC public schools as a high school teacher, worked as the lead organizer of a political campaign, provided technical assistance for organizers all across the country, and served as a facilitator for various leadership training programs for social change leaders. Prior to taking this role with ANHE, Jeremiah created a program with a team of consultants at the Rockwood Leadership Institute called the Heart of Black Leadership that provides a unique leadership training specifically designed for Black leaders working within the social justice movement in response to the summer of 2020. And also know, and Jeremiah, I don't remember your official role at Healthcare Without Harm, but Jeremiah also works with Healthcare Without Harm. We're so glad to have him on the A team. So I'll turn it over to you, Jeremiah.
Yes, thank you, Kara, for that introduction. I don't think I've ever heard that out loud, but that was cool. Um, yeah, so I'm the Annie Fellowship Director. I've been with Annie for 3 years now. Um, and I love Annie, um, and think that the work that we do is so important. And so I love being able to support nurses. And that kind of brings us to this um, new toolkit. And so we're talking about the Annie Nurses Sustainability Toolkit. And the question just comes out first, why a toolkit? Um, Prior to my time here, I heard from Katie and Kara that uh, Annie had a nurse sustainability toolkit. Um, However, that was created years ago. And so what we wanted to do was put together a toolkit for nurses that was a little more modernized, more up to date, that had actions, resources, stories for nurses that are wanting to lead some kind of sustainability initiative in their clinical setting. And so I know from the nurse fellows in the program, they do a lot of work with community-based organizations outside of the clinical setting, um, but in conversations with them as well, there's been a lot of like, what can I do at work? And so we wanted to provide a bit of a roadmap on how to do so, and thus the toolkit was born with the support of the Jonas Foundation. Some things just to go over, as some of you may know, uh, healthcare is responsible for 8.5% of the US's greenhouse gas emissions. And this is from things from waste to the fleet vehicles to the cleaning products, meat procurement, food transportation, uh, anesthetic gases, energy used for heating, cooling, lighting, water, and so forth. And so there's a lot of places by which actions can be taken to reduce um, those emissions and impacts. And as it was with everything with Annie, we believe in the leadership of nurses to step in and lead those efforts. Uh, and so this is what the sustainability toolkit will provide. One, again, education. We have some webinars, we have some podcasts, we have some videos. We've also pulled resources from Healthcare Without Harm and other organizations that have produced uh, toolkits, guidebooks, and so forth on the issues. And then we also conducted some interviews of nurses who've done some work and put together some case studies. And so if reading the documents themselves seems like a lot, you can read about what a nurse has done and kind of follow in their footsteps and do a similar project or offering at your health institution. Click. So this is just all the kind of things that folks can do from a broad sense to um, take action, whether that's educating patients and colleagues, reduce, reuse, recycle, choosing local sustainable foods, educating the community, joining or starting a green team. There's many things for folks to do. And I think a lot of the times people are like, well, then what do I do if there's so many things? And it's like, pick where it seems feasible, start where your passion lies, and kind of go from there. And so we started building this resource library in the spring of this year. We were able to finalize the toolkit um, last month. And today is the quote unquote launch day. Technically, it's already been public. We just haven't put it anywhere. The idea is folks will be able to operate it, check it out, and then not just give feedback, kind of hoping that if folks come across other resources, they can send it along because we can make updates to this uh, as we're going, so it stays up to date, and we don't have to do another big nurse sustainability toolkit 10 years from now when all the resources are once again out of date. Let's see. Oh, so this is the website. It's toolkit.nvern.org. This is what the main page of the website looks like. You can go in and read about it. There's case studies, there's resources. The resources are broken down by category. And then there's also this little section called Stories of Inspiration. Those are stories that we took from the Nurses Climate Challenge of nurses who have kind of come to the realization of how important it is uh, to, of course, center on environmental health as well as incorporating it in the clinical setting. And so not just worrying about clean air, clean water, um, healthy foods, but bringing that concern back into the clinical setting. And so what I'm going to do now, this is going to be funky. I'm going to pause my screen and I'm going to just walk us through the website itself. Let's see if I can do this. Boom, 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 boom. Unpause. Give me a thumbs up if you can see what I see, which is the website. I hope people can see it. All right, good. I know how to use it. So yeah, so here's the website. You'll see on the main page, we have a link to the resources, link about the toolkit, explore case studies. You can scroll down. We have a few featured resources, just ones we picked out that would be a good place to start. There's a video on food sustainability at St. Pat's Hospital with Sarah E. Johnson. There's a featured case study about Stephanie Santos. And then, of course, a featured resource, the global roadmap for healthcare decarbonization. And I believe that's from Healthcare Without Harm. You scroll down some more. This is ANHE's mission and vision. Let's just go ahead and start with what I would say is my favorite piece of the toolkit, and that's the case studies. And so when we first came up with the idea, again, I believe it's really important to see what's possible before coming up with what it is that you want to dream and vision. Like you got to know that you can do the thing before you set out to do the thing. And so we talked internally as a team about interviewing nurses that we know who have done sustainability initiatives and were successful. And we set out and interviewed them an hour, took a bunch of notes, and then turned those interviews into case studies. Let's see, the one that we had featured, I think it was Stephanie Santos. So you click it, and I'll show you who's the interviewee, where they work, and it talks about their background, the initiative, the project that they implemented, overview, um, how they implemented it, who they talked to at first, who were their collaborators, challenges that they ran into, solutions to the challenges, the results and impact. And then at the very bottom is like a pretty good section that just says advice for nurses starting similar initiatives. And so you can read about the whole tale as well as what they would tell people to do if they were trying to do a similar thing, and then it concludes. And so all of them are broken down in this kind of format: background, project, challenges, collaborators, advice. And so I highly encourage those of you who are interested to just go through all the case studies. I believe there's 10. We'll be adding to them as we come across more nurse-led sustainability initiatives, but I really think like this is the piece that I'm the most proud of, because it puts faces to stories, and again makes real the work that nurses are doing. Then we break into the resources page, and we broke them up by categories. So there's resources on chemicals, decarbonization, energy efficiency, food procurement, health professionals network, organizational leadership, OR and surgical services. I'll just pick this one. And you go in, and there'll be some documents, creating the operation room. We linked some of the case studies inside the categories that they fall into. That's just Oxide Toolkit, videos, and so forth. So you can go in based on resource, and again read up, find, and they'll link actually out to the website that they're hosted in. So I click green in the operating room, and takes me to the American Society of Anesthesiologists, and you can find all the stuff they have on their website. And then the last section is again the stories of inspiration, which is taken from the Nurses Climate Challenge. A lot of the stories of nurses who started just focusing on nursing, and then realized the threat that is climate change, and have broadened their scope to addressing environmental health. And so the difference between this section and the case studies section is the case studies section is about sustainability initiatives and projects, whereas the stories of inspiration are more about like the about face, the realization, the journey towards why it's important for us, to focus on environmental health. So that's the entire toolkit. Again, we'll be adding to it as time continues, because we want this to be relevant. We want it to stay relevant. We're still gathering resources to add, but I'll go ahead and pause there. This loads, and take any questions.